Now you have a retreat that's called Eat to Live Retreat, is that right?
Yes, the Eat to Live Retreat in San Diego.
Tell us a little bit about that.
It's really like a great idea because all my decades of treating people who were trying to have them eat healthfully, some people fail. They don't necessarily follow the program. They fall off the wagon, so to speak, and they lose weight and gain it back again, or they can't really give up their foods they're addicted to. And they just have trouble adhering to a healthy diet. So I wanted to, and I knew that some people need to be in a safe environment where they can be forced abstinence from their addictive triggers so they can lose the desire to kind of have those foods. And when people change their diet, we knew over the years when people go away for a week to a conference and learn how to eat this way, there's not a high probability of the majority of people making the change because they're thrust back into their home environment and they haven't really gotten rid of their addictive connection between self-destructive foods. So my retreat is based on longer stays. The minimum stay is 30 days. We advise people stay 3 months who are overweight and who have food addiction. So it gives me the opportunity to have time pass so they can lose the strength of their addictive drives to want to eat unhealthfully. They can develop new taste muscle and build up the knowledge, both philosophically, emotionally, intellectually, and experience the pleasures and joys of living so healthfully. So they have the tools in place when they go home to be able to replicate this and not want to go back to their old way of eating.
To be a leader when they go back home.
Exactly. To be a leader and to be a role model and to enjoy eating this way. So I made a retreat in San Diego, mostly for people who are overweight and have medical conditions, but most of them don't have medical conditions. Most of them are just overweight and have trouble following a healthy diet. They're too tempted to eat foods that aren't good for them. But after they stay at the retreat for a period of time, 2 or 3 months, they're better in control of their choices and they can replicate what they learned there. And they can go home and it dramatically increased the probability of them staying long term. This is all about sustainability. They come to the retreat because your health is ultimately gives you your ability to sustain eating healthfully for the rest of your life for years and decades, not for dieting and losing weight and getting it back again. There's no value to making a change if you're not going to stick with it. So we have people come to the retreat so they can learn to make the changes that they can learn how to stick with, and we have the tools so they do stick with it for the rest of their life. That doesn't mean we succeed in every case. We certainly radically increase the probability of that happening.
And what kind of other issues might somebody want to do this before? I know you said obesity. Could this work for somebody with type 2 diabetes and cancer and heart disease and any other kind of chronic disease?
I see a lot of people with high blood pressure and diabetes, obviously, because almost everybody has that when they're overweight. And I have a success rate of about 75% of type 2 diabetics becoming non-diabetic within 6 weeks. Within 6 weeks, 75% become non-diabetic. And within 6 months, 95% become non-diabetic if they stick with it. So we're saying here, yes, and same thing with high blood pressure, that they are able to reverse their high blood pressure, reduce their atherosclerosis, improve their vascular elasticity and the youthfulness and oxygen perfusion of their heart, get back to a safe state where they're not going to have a heart attack, and get off their blood pressure medications, off their diabetic medications, off their statin drugs. They feel better, concentrate better, they become more creative, more happy, and they're able to function and not have the brain fog that they had before they. So yes, as you get off those medications and you start feeling better and eating right, they all say the brain fog lifted, and they're able to focus better and be a better version of themselves.
What about like cancer? Have any luck with that?
I've been in practice for more than 3 decades now, and I've taken care of a lot of people with cancer. And obviously, cancer is a bizarre and aggressive and unpredictable disease, and it becomes more bizarre, unpredictable, and aggressive the longer you have it and the more advanced it gets, closer you are to death. So certain people have come to me close to death where we could not impact their cancer significantly, but you never know. I've had some people with metastatic cancer that have done really well and survived now 20 years, 25 years or more. Wow. And were supposed to die. But the earlier in the cancer you are able to impact their diet with a person with something like cancer, the more impact you're going to have it, perhaps extending their lifespan. Many men with prostate cancer whose PSA have normalized and went back the other way and actually have recovered from prostate cancer. I have many men.
Without any kind of surgical intervention or chemo or whatever?
That's correct, just with the diet alone. Yeah. And I have numerous people with non-Hodgkin's lymphoma that went away with no chemotherapy, just went away with the diet. And I have patients and experience with people with metastatic cancers like metastatic ovarian cancer that were supposed to have died that have now survived a decade, 2 decades or longer when they were supposed to have been dead because their ovarian cancer never came back. And we think that the reason the long-term prognosis for ovarian cancer is so poor is because the cells that escape chemo are now more resistant to chemo. Those are the cells that escape, and when the cancer comes back 5 years later and starts replicating, it's hard to treat it because those were the cells that were resistant to chemo the first time, that escaped and started to replicate again and escaped the initial kill.
They've evolved.
Yeah. So when the immune system is improved to be able to ferret, identify, and remove stray cells, I see many of my patients successfully living and not have secondary recurrence of their cancer. And we think it's because their own immune system is so strong that those little stray cells are be able to identify and removed by their immune system. It was an adjunct to chemotherapy that made the treatment work better and work effectively.